I'm Sheila Decker, and this is my evidence-based practice project for therapeutic exercise. I had wanted to investigate if trigger point release used in conjunction with stretching techniques was more effective than stretching alone in reducing pain and increasing range of motion in patients with shoulder impingement syndrome. However, I could not find an article comparing these two treatment techniques. The article I found investigated the effect of trigger point release on patients with chronic shoulder pain. To find this article, I searched within the ProQuest Health database using the terms trigger point release and shoulder impingement. This systematic review was graded 1A on the CEBM critical appraisal scale, meaning it has a high level of evidence. This score was based on the review process and the consistent and reasonable inclusion and exclusion criteria. After a review of the literature, only 2 articles were acceptable given the predetermined criteria. This systematic review investigated the effectiveness of trigger point release and therefore has significant external validity. The results of this systematic review suggest that trigger point release of the musculature surrounding the shoulder can be an effective method of reducing pain in patients who experience dysfunction as a result of chronic shoulder pain. Trigger point release is a simple and cost-effective manual therapy technique, which can easily be incorporated into clinical practice. It takes minimal time and equipment, however, it does require a thorough knowledge of anatomy. It is especially important that the clinician practices proper body mechanics when performing this type of therapy, since it can place high amounts of stress on the thumbs, fingers, and wrists.